I'm Frank Hanley. I'm a pediatric and congenital cardiothoracic surgeon, which means I operate on babies, children, and young adults who have congenital heart problems. And I also am the executive director of the Children's Heart Center here at Lucile Packard Children's Hospital at Stanford, which the Heart Center oversees not only the clinical work where we see patients and care for patients and operate on them, but we also have educational objectives as well as a very significant research initiative as well.
Mhm. So, my first question for you is what motivates you to do what you do?
There are a number of things that motivate me. First and foremost, it's extremely rewarding to be able to make a difference in the lives of young people who have sometimes critically significant conditions related to their heart that is going to either be lethal or very limiting to either their length of life or quality of life, and be able to use our skills and our knowledge to correct those conditions, to give these children, babies, and young adults the opportunity for sometimes a completely normal length of life and quality of life, or at least a much improved quality of life. So that's very, very rewarding. So that's the biggest driving factor, and the one that relates to the sense of contributing to the world and making a difference. And that's the more altruistic aspect of it, which is probably the most important. But I wouldn't deny or reduce the influence of it's also a very challenging intellectual process. The cardiovascular system is very complex. The kind of work we do requires a very unique understanding of three-dimensional geometry and physiology all combined together. So it's a very intellectually challenging and rewarding career to have from that standpoint as well.
Mm-hmm. And it's great what you do. Um, so my next question is, from a surgeon's standpoint, do you think that screening should be mandatory or highly recommended for all student athletes? Why or why not?
Yeah, that's a really good question. And like many other questions in society and in life in general, where the complexities of all of the practical aspects of the world come into play, it makes it a difficult answer. So in the ideal world, yes, every young person who is going to be extremely active at a competitive level, in the ideal world, it would be great to have all of them screened for potential conditions that could cause difficulties. Where the ideal bumps into reality is that that would be extremely expensive from a medical care standpoint. And so there really aren't any programs in the United States that I know of, locally, regionally, or certainly not nationally, where there is a mandate that all student athletes get screened, at an extreme level for cardiac disease. It's one thing to say if you're going out for a competitive sport, you should have a doctor's appointment and a physical exam, which that's easier to do and that is recommended. But then to say the added expense of sophisticated cardiac evaluations with things like echocardiograms or MRIs or stress tests,
Mm-hmm.
that then becomes an overwhelming burden on the medical system. And from a practical standpoint, that's difficult to achieve.
So what are the most common heart defects or conditions that may result in sudden cardiac arrest in young adults?
Yes. So the most common one is something called hypertrophic cardiomyopathy, where the child has a thickened, enlarged heart. um, that is not a normal situation. The heart is not, it's not that the heart is enlarged because you're training and you're competing and working hard. It's an abnormal signaling in the heart muscle that just makes it get thicker for no good reason. And it's well known that children who have hypertrophic cardiomyopathy, they have a definite increased chance of cardiac arrest or sudden death with exercise. So that's one of the main things, and probably the most common. Behind that, anomalous coronary arteries is a second condition which has a similar outcome, where there's an increased chance of sudden death with exercise, sometimes with very little or no warning ahead of time. And those are the two most common structural cardiac conditions that put young adults at risk.
Mm-hmm. And once one of these heart conditions is detected through screening or testing, how do you decide whether or not to perform surgery?
Yes. For hypertrophic cardiomyopathy, unless there's an extremely high blockage within the heart, which sometimes there is and sometimes there isn't, we probably would not recommend surgical intervention.
Mm-hmm.
If the individual has hypertrophic cardiomyopathy without a severe blockage, then the recommendation would be that they do not compete in athletics at an extreme level, and they just modify their lifestyle. Again, if there's a severe blockage within the heart, then oftentimes surgery will be recommended to relieve the blockage. Even after the blockage is relieved surgically, we still do not recommend competitive athletics if you have the underlying condition of hypertrophic cardiomyopathy, even if it's treated. With the anomalous coronary arteries, it's a little bit more complicated, and because it falls into several different categories. The normal cardiac anatomy is that you have two main coronary systems. You have a left coronary system and you have a right coronary system. Both of those coronary systems, coronary artery systems, are the conduits of bringing blood flow to the heart muscle to keep it healthy. The left coronary system pretty much feeds the blood flow into the left ventricle, which is the main pumping chamber that pumps blood to the body. And the right coronary system primarily feeds blood flow into the right ventricle, which is the main pumping chamber that pumps blood into the lungs.
Mm-hmm.
The left coronary system going to the left ventricle is the larger system and the more important system, and it feeds blood into the ventricle that's doing the hardest work, that is the left ventricle. So if you have an anomalous coronary and it's the left, then the general consensus recommendation pretty much everywhere in the world, and certainly advocated by the American Heart Association recommendations, is that that coronary artery should be surgically repaired before you allow the individual to exercise at a high level, and that would certainly include competitive sports. Where it gets a little bit more in the gray zone is with the right coronary artery. If you have an anomalous right coronary artery, then we have to break the situation down into several different subcategories, because not everybody with an anomalous right coronary artery needs surgery, and also not everybody with an anomalous right coronary artery necessarily should be limited from extreme exercise and competitive sports. So with anomalous right coronary artery, certainly if the individual manifests any symptoms suggestive that the heart's not getting enough blood flow, that patient should have surgery, absolutely. But that leaves a big group of individuals with an anomalous right coronary artery who are completely asymptomatic. They have no symptoms. So if we find this and someone wants to compete at a high level in terms of aerobic exercise or competitive athletics, then we start looking at more detail of what the anomalous right coronary artery looks like. It might be anomalous, but if there's no evidence of the opening being slit-like or narrowed, if there's no evidence of the artery passing between the aorta and the main pulmonary artery where it can be squeezed, if there's no evidence of it running inside the wall of the aorta where it also can be squeezed, then, and the person has no symptoms whatsoever, we might allow that individual to exercise normally. However, if you have any of those findings which are concerning with an anomalous right coronary artery, even if you have no symptoms whatsoever, we would recommend surgical correction. And the reason is because we know that a certain percentage of individuals with those findings, along with the anomalous right coronary artery, even if they have no symptoms whatsoever, will have a cardiac event at a rate that is higher than in the normal population.
I would just like to say for the record that I had an anomalous right coronary artery, as you may remember, and I did decide to do surgery, and that was because I felt that competing in competitive sports was important enough in my life that I wanted to eliminate the risk of anything happening. And that is the wonders of surgery, I guess. And so my last question for you would be, so once a decision has been made to perform surgery on a patient, what do you tell the families who might be fearful or uncertain about the operation and its outcome?
Sure. Any operation is going to be um, upsetting and anxiety provoking both for the patient and for the family. You're doing something that you don't do every day, and it can be difficult. Um, the most encouraging words I can provide to families is to give them a track record of our performance with this operation, and emphasize to them that the big fears, big concerns about either not waking up from surgery or waking up with a major complication or brain damage, not making it through the surgery, that is extraordinarily unlikely. And in fact, for this type of procedure, in the hundreds of operations we've done, we've never had any of those things happen. Those are that's the kind of communication that can be very reassuring to patients and their families that they're undergoing a big operation for sure, but one that can be done extremely safely.
Yes. And so those are all the questions I have for you. Do you have any questions for me?
No, other than how are you doing?
I'm doing well. After my surgery, I returned to sports, and I've been playing soccer at my high school ever since my surgery. And I'm going to be a senior this year and eventually apply to pre-med for university.
Oh, that's fantastic.
Yeah.
Well, congratulations on all your accomplishments so far. And if there's anything I can do to help you as you move through your potential medical career, certainly let me know.
Thank you. That's very reassuring.
Thank you. Very nice to talk to you.
Likewise.
Okay, bye.